Okay, welcome everyone to another week of the BetTalker podcast brought to you by BetBlocker. Today we have Gemma with us. Gemma is a researcher and she researches really interesting topics. We'll get there in a bit, but for those of you that don't know Gemma, uh, Gemma, would you be able to introduce a little bit yourself? Tell us how did you end up here?
Sure. Well, thank you, Pedro, for everything. I'm Gemma. I'm a researcher. I studied psychology a few years ago. And after that, I started in the clinical work. So I started treating people in a hospital, and those people had compulsive sexual behavior disorder.
Okay.
So I didn't start with gambling. I started with with this disorder, and after that, I had the opportunity to work in another hospital doing my PhD, and then this time I started to focus on gambling disorder because in those hospitals they have a unit specific to treat people with gambling disorder. So I started there. I did my PhD there for 4 years, I think, and I was there, and then I was at Yale University too to finish
Oh,
my
wow.
PhD because it was international. And yeah, I spent these years doing all the time research about gambling disorder. And when I finished my PhD, I had the opportunity to receive a postdoc grant in a university in Spain. It's called International University of La Rioja. So in that postdoc grant, I had to focus specifically on problematic pornography use. And then I started to do research there. I created a research group. I am the PI of the research group. Is focused on behavioral addictions in general, and that's what I'm doing now. Yeah.
Oh, wow, that's super interesting. I didn't, because you find a lot of researchers that they never had experience with clients. So they do BA, masters, and then next one a PhD or postdoc or whatever. But they are all very theoretical. But it's really interesting that you work in two units. The first one you say with people with sexual compulsive disorder.
Yeah.
Okay, how was that?
Because I was really interested in sexual disorders. I don't know why. Since when I started psychology, maybe because my mom is also a psychologist
Okay.
and she was doing the sex part in the school, and she teaches us the sexuality. I don't know, maybe because of this, or maybe I don't know. So I was super interested in this kind of patients. So I did a master degree on sexual disorders. And I was so lucky because I met the boss of the unit in a conference, and he accepted me to start working there. And yeah, I had the opportunity to work with this kind of patients with compulsive sexual behavior disorder. So I think this mix between the clinical part and research part uh, is really good because you can imagine in each research you do, you can imagine your patients you had in the past, or the patients that your colleagues have right now, and then you have a broader picture of these disorders.
That's super interesting. Sorry if I'm going a little bit off script, but what type of clients were you seeing there? What sort of sexual disorders? I don't know, like were you encountering there?
Yeah, well, first I started with specific patients that were women with female genital mutilation.
Okay.
And they went to the hospital because it was the first hospital in Spain that did the surgery of the reconstruction of the
Mhm.
clitoris. So I was with these patients during all the process, doing psychological work with these women. And then I started to work with mainly with male patients with compulsive sexual behavior disorders. And some of them were at jail because they had some problems with this sexual behavior. Some of them no. It was like a yeah, a lot of patients come there because it was the main hospital unit treating this kind of disorder. So patients from all over the country came to that country to be treated.
Oh, that's a really interesting. Because I am a psychologist, but I never practice in Spain. I moved to the UK, and then I did my postgrad in counseling and all that, and then I saw people as a counselor, mainly psychodynamically, and I remember at the university, like a lot of male students, they had problems, because of watching a lot of porn, having like ideas sometimes about sex and sexuality that they were not real, and this sort of stuff, and I was a bit like, oh wow, this is a big problem that uh, there's not enough people talking about it. So that's really interesting, and also the thing that you were saying, that many times when doing research, you think about people that you have worked with, and it's quite interesting. Okay, uh, tell me a little bit about your next step, because you said that then you moved to work into gambling.
Sure. Yeah. After I was in that hospital working with this kind of patients, I started the PhD and I started working on gambling disorder. Gambling disorder share a lot of features with the other disorders. So patients were more or less having the same symptoms. Because gambling and compulsive sexual behavior disorder both are proposed as behavioral addictions, so patients have usually a profile that is similar. So it was also so interesting to have everyday contact with patients with gambling disorder and also other behavioral addictions, because in that hospital, apart from gambling disorder, they treated, for example, compulsive buying disorder or gaming disorder, so different behavioral addictions. And it was really interesting to be in the treatments with this. I was not doing clinical practice there. I was just watching how they work and doing my research. But it's really interesting because again you have both perspectives, so it's really interesting. And yeah, I was focusing my PhD in impulsivity and compulsivity in this kind of patients. And yeah, I was doing all my research using the patients that came to the hospital for clinical things. So yeah, it was really interesting, the change from sexual compulsivity to gambling disorder.
Okay. What are the most extreme cases that you have seen, working in gambling disorder?
Oh, okay. I focus, one of the studies that I included in my PhD was focused on impulsivity, but in patients that did illegal acts related to gambling in order to have money to continue gambling or to pay the debts or things like this. So the patients that I included in this study, most of them came from jail, so they were at jail for these illegal acts, and they came to receive treatment, and they go to jail again. So they came with police, and it was really extreme cases that. But it was interesting because. they usually don't have a profile like a criminal profile, typical profile that you study when you study criminology or things like this. They are regular people that never did any illegal act before, but they are desperate, maybe because they bet, I don't know, their houses or their cars or everything, and they lost everything. So they need money to continue paying the bills, the microcredits, or whatever. So at the end, what they decide is to do illegal acts like this, like stealing in their companies, or maybe, I don't know, some patients pretending to have accidents in order to get the
Like some
insurance.
fraud or something like that. Okay.
Exactly. So yeah, these cases were really really interesting because the profile was not a criminal profile, but they were having problems with the law.
It's interesting because I remember at university first time that I have been at university like 4 times now. The first time, there was a group of inmates and they were doing like theater or something, and I was just just buy him one a coffee or something. I have a chat with him. I mean, the police was around, and I remember that one of them said, uh, anybody could end up in jail, and the person told me that there's a bit of two kind of people, the career criminals, okay, they start bit, and then sometimes something goes wrong in life and make bad decisions or get into a fight or do something stupid that spiral, and then they end up in jail. So it's interesting that you say, okay, there's two types. Also, something that I think I remember that in the DSM-3, maybe to the DSM-4, they removed that criteria because before, I think, to have committed criminal acts or having done some embezzlement, there was one of the criterias, and then it was removed. Could you
Yeah,
tell me a bit about that?
if I don't remember wrong, it was in the change from DSM-4 to 5.
Four to
They,
five. Okay.
I
Yeah.
think so, they deleted this criteria. It was a really interesting discussion between researchers in this, because some of them thought that only people that are really, really with high gambling disorder severity could do this kind of illegal acts. So at the end, they decided this was not a criteria, a diagnostic criteria. It was a severity criteria. So they decided to delete this criteria, even if in clinical settings they still use this criteria, because it gives you a lot of information of the case. So, for example, in Belviche, they still ask to each patient if they committed illegal acts, what kind of illegal acts, if these illegal acts had legal consequences or not. Because, for example, in my PhD, I said that there are different profiles. If your illegal act had legal consequences or not, they are different kind of profiles, patients, no? So it's a really interesting information that you can take when you are working with this kind of patients.
Mm. I wonder because I have met both types of people affected by you know gambling disorder. You get some of them that was a red line, like committing. Say, okay, I had a gambling, but I never stole any money or I didn't do any fraud. And there's other people that they cross that line, and sometimes say, oh well, it's not me, it was the gambling. So it'd be like, okay, you get people that maybe they get a bit more control, and there's other people that maybe, and people, that maybe did something illegal. At some point, they didn't mean to do something illegal. It's okay, I'm going to borrow the money and then I'll pay it back, and then it never happened. So it'd be like, that they maybe they didn't mean to, but then things just
Yeah.
spiral, and maybe once you cross the line, it's easier to cross it for the second time.
Sure. Well, with gambling disorder, what we see is that there's a lack of control of the behavior. So, usually, these kind of patients have a lot of difficulties to control what they do and the consequences of their acts. So, yeah, it's more usual than we think to do this kind of things. But sometimes these things never had legal consequences. But yeah, it's not super usual behavior, but yeah, it's there, and it's important to study it in deep.
I mean, I don't want to put you in a spot, but roughly, what percentage of people with gambling disorder end up committing crimes? I mean, I think probably we can Google it, but do you
Yeah,
think don't
I
know? No,
no, I don't know the exact percentage, but it's not super high, but it's more common than we think. Yeah,
because I remember in one of the episodes we had a person, and he said that he used a flatmate's card. He spent, I don't know, like 1,500. And he said that okay, he almost go to jail. I was thinking, oh, I can't believe that people go to jail for 1,500. It sounds a bit like really harsh. Sometimes you say, well, maybe the bank should have done some checks or something, rather than someone that, okay, is in a really difficult situation that makes the bad decision, maybe to get someone's mail post and then using the card. So I mean, I'm not condoning that, but sometimes I say, like, it's a bit harsh to put someone in jail
yeah,
for I think that is mental health.
sure. Well, what I know is that at least in Spain, when you have problems with the law and then you go to the lawyer, and if you can prove that you have gambling disorder, they take this into account sometimes. Usually, well,
It's like a mitigating factor.
yeah, it should be. And
Okay.
for example, my supervisor in the PhD, Susana Jimenez Murcia, who
Yeah.
was the lead of this unit, so she usually had to go to the lawyer and to talk to them to prove that this patient is receiving treatment, and he had a problem. Well, he or she, usually he, had a problem. So yeah, so it's a information that they take into account, but still, yeah, it's complicated, and also it's complicated to study it, because when I started my study and trying to get all the information from each patient, I discovered that it was really hard, because they are afraid that you take too much information, because maybe they had no legal consequences, so they don't want to talk about it just in case. So I think the percentages that we can find in studies maybe are lower than the reality.
Because there's an additional stigma. Okay, you get the stigma of gambling, plus the stigma of fraud or any sort of.
Exactly.
Okay.
Imagine a woman that has double stigma because of gambling, because of being woman, also if it's a mother because of being mother, and also if she committed an illegal act. So it's like a lot of stigma there. So
Piling up. Okay, tell
yeah,
me a little bit more about stigma and women. Have you worked with many women
yeah.
problematic gambling?
We are really interested in women, because it's not typical that they come to the unit and ask for help. Um, they usually don't ask for help even if they have gambling disorder. So we wanted to know what's happening with women, what kind of profile have the women that come to the unit and ask for help and everything. And so we started one research line on women. And yeah, I remember one of the studies we did. It was really interesting, because we had a debate between the research team. Um, around if women is a mother, if they had more probabilities to ask for help and go to therapy and finish the therapy, because they are more motivated to be well and to recover, or if this kind of women that are moms, they don't have time because they have other responsibilities, so they don't go to therapy. And so we check it, and it was really interesting. And we asked them for stigma and for family support. So in research, what they usually say is that women feel that they have double stigma, and this stigma usually is the barrier that prevents them to ask for help. So yeah, it's more difficult for women to ask for help, go to therapy. Also, if the spaces are group therapy, usually all of them are male. They don't feel comfortable usually in these spaces. So I think it's important to take in mind these gender differences, and maybe create groups only for women, or protect these women, and take this into account, that they have stigma and barriers, and it's so difficult for her to ask for help. So we need to help them to come.
What can we do to fight this stigma? What, like, people that they work on gambling harm minimization, people that they work as clinicians, researchers.
Yeah, I think it's complex, because gambling is dual. So if you gamble nowadays in some specific kind of gambling, for example, sports betting, so you are cool. This is the message that you receive usually in the street. No, oh, you gamble in sports betting, you are cool, blah blah blah. So it's a really good thing socially, it seems. But once you have a problem with gambling, then it's a really bad thing. You Because usually this lack of control that you have in gambling disorder, society perceives it as you decided to do this. So they don't take in mind that this is a mental disorder. Like, for example, in depression, people are more conscious that this is a mental disorder and
Mhm.
this person has a problem. In gambling, it's like, oh, you decide to do the thing. So I think we need a lot of psychoeducation in the society in general. We need um, to check the advertisements, to check all the information that we are giving to young people and all the society. Uh, and I think that it's a work that we should do all together to reduce this stigma, and to explain people that this is a mental disorder, and these people are suffering a lot, and that they don't decide to lose all the things that they have, or to get divorced because of this, or all the negative consequences that are around gambling disorders.
Yeah, because for example, if someone has a problem with drinking, that there's maybe not that big stigma, even if the person maybe, I don't know, X years ago decided to have their first drink or go out with their friends. And so I think, this sort of thing still, this sort of, uh, sinful, maybe, oh, it's something bad, or something like that, which I think, okay, or if you're anxious, if people, they're not going to tell, well, it's your fault because of,
Exactly. I think that the perspective is like, I don't know the word, bias. Uh,
bias.
no,
Oh,
like
no, a bias. Yeah, yeah,
it's a,
yeah.
it's a bias
Exactly.
instead of a mental disorder. So we need to change this perspective and work together because a lot of things we have to do. Yeah.
Yeah. Did you have you ever gambled?
Yeah, I have tried in bingos and the lottery, because in Spain, lottery is so typical activity. Yeah, gambling in Spain is. is really everywhere. So I think it's typical in Spain that all the people have tried some kind of gambling, but yeah, just I tried just few times. Yeah.
Okay. Uh, uh, why do you think some people, okay, they can, buy some lottery or play some bets and they're fine, and then there's other people that, it's not fine with them?
Yes, well, there is one theoretical model. It's called IPACE model. I really like this model because it tried to explain why, in front of the same stimuli, in this case gambling, some people develop problems with gambling and some people no. And the thing is that there are a lot of factors there, like in a recipe when you are cooking. So there are like genetic factors, there are personality factors. For example, if you are more impulsive, you maybe you have more propension to develop this problem. Also, if you have other kind of mental problems, it's more usual than you will finish with gambling disorder. So there are a lot of factors that we should take into account, and also accessibility. So because we have to focus first on the individual and take into account all of these factors, but also we have to explore factors from the environmental perspective.
Mm.
So accessibility is one thing that is really important. If I live just in front of a casino or a gambling space, it's more common than I develop gambling disorder. So yeah,
Okay.
a lot of
I mean,
factors.
it's really interesting. It sounds a bit that the iPace like the pathway model from Blasinski. I mean, probably is the newer version,
It's
like.
the new version because they took this and they took other models that have been developed in all of these years, and they put all of these factors together to explain this. And also they add the explanation on how the things change once the gambling disorder develops, because it's not the same when you are starting with the problem than when a lot of years passed. And they add factors like impulsivity, compulsivity, how these things change with the time. So it's really, really interesting, the connection between time and severity and executive functions and a lot of things that they try to explain together. So they have published now, I think, three manuscripts. The model, it was in 2016. Then in 2019 they published another actualization of the model, and just this year they published another one. So they are trying to every time to explain why these people develop an addiction and other people no. Yeah.
So, it's quite interesting because I always have seen addiction a little bit like a symptom rather than the main problem, because you always find a lot of comorbidity, like anxiety, depression, substance use disorder, uh, traumatic child, so it's always very complex. I never have seen someone that say, oh, my only problem is gambling. Or you may find people that they say that, but then when you ask, oh, okay, if you didn't have gambling, what would it be the next problem, even if it's small? And then actually it's pretty big problem, the second one. So sometimes, I always have, being a bit fond of the self-medication hypothesis. And I also sometimes think that, okay, maybe a global theory, maybe different people, develop it for, due to, or that is very difficult to get a theory that can explain gambling for everyone.
Yes, it's a really interesting thing. I have had this debate with a lot of colleagues because when you go to conferences about addictive behaviors, some people strongly agree with the dual pathology model, saying that what you were saying, that usually gambling disorder is always with other kind of mental disorders together. I was talking with Susanna, for example, to know what she thinks about this, and she said that she, in all of the years that she was working in clinical practice, she saw a lot of patients that just came for gambling disorder, and then the other problems were consequence of gambling disorder. I'm not sure, but when I was doing my PhD, my focus was on the dimensional perspectives instead of the categorical perspective. So it was really interesting because a lot of studies are saying that maybe we are assessing wrong the mental disorders, and that's why one person has different or multiple disorders. And maybe what we should do is not focusing on specific symptoms, is focusing on factors that are transdiagnostic. For example, impulsivity, emotion regulation, because we can find problems of impulsivity in a lot of mental disorders. We can find problems with emotion regulation in a lot of. So maybe we are focusing on the wrong things. But if we defend this, it means that all the perspective in psychiatry and psychology is wrong, which is difficult to
It
accept.
is, it is a very interesting thing because you say, okay, maybe you just have to work with the impulsivity with this person, and probably can sort out like multiple problems. I think also probably depends on the approach that you take. For example, if you're more CBT like, and you're focusing in the problem, probably you're going to focus in the problem and the consequences. If you're maybe a bit more psychodynamic, and you dig in the history of the person, you're probably going to see, okay, no wonder this person end up developing a problem because he had all this baggage. Sometimes I think it may be the focus, that we have. That's very, interesting, and it's you know I think it's something that you know I don't know how would you approach that from a therapeutical perspective. Okay, let's work with the impulsivity or the emotion regulation.
Yeah, the problem is that when I was doing this dissertation, I realized that it's really hard to know what factors we should focus on, because there are a lot of models talking about different transdiagnostic factors like yes, impulsivity and yes, emotion regulation, and a lot. So if we change the perspective and we don't focus on symptom, it means that we maybe could put together in the same group therapy a person with bulimic disorder and a person with gambling disorder and a person with substance use disorder, for example, and we could talk about impulsivity, emotion regulation, and the other transdiagnostic factors without talking about symptoms, and these people could recover. This is the transdiagnostic perspective, which
Yes.
it's
Okay, nice. Sounds quite cool. I have a look into that.
yeah, but
Um,
it means that we should change everything because we
okay.
right now we have units of each disorder, like eating
Mm,
disorders, addictive behaviors, and if we change this perspective, we have to change all the system, which is complex.
yeah, no, then probably, after 30, 40 years, probably you decide that it doesn't work either, because, we see, at some level that despite more focus on mental health, it feels that mental health in general is getting worse.
Hmm, sure, yeah.
Uh, moving forward, because you said that then you sort of did your research on like porn addiction, or
Yeah, problematic pornography use. Yeah. Well,
did
we
you
call it problematic pornography use because it's not
okay,
recognized as an addiction right now.
okay, problematic pornography, yes, okay.
Yeah.
Could you tell me a little bit about it? What's considered uh,
Yeah, it's
problematic
really
use?
interesting because So from the addictive perspective, which I work on this perspective, we defend that some behaviors like gambling, gaming, buying, sex can have a potential addictive. So
Mhm.
can be addictive for some people, not for everyone. For some people, they can develop an addiction, and after a lot of time defending this perspective, gambling disorder was the first disorder accepted as an addiction, a compulsive addiction, um, behavioral addiction. Sorry.
Mhm.
So after that, they accepted other disorders as mental disorders, but for example, compulsive sexual behavior disorder was accepted as a mental disorder, but still is not accepted as a behavioral addiction. So we
Okay.
need more research on this. And the thing is that problematic pornography use has been included as a symptom of compulsive sexual behavior disorder. But what happened is that people that are doing research on problematic pornography use, we defend that it should be a different category. No, it's not a symptom, it's a real problem for a lot of people that ask for help, and they only have this problem. So thinking that is a symptom, it's not enough. So we are fighting to have problematic pornography use as a condition, a clinical condition like gaming disorder or gaming disorder or whatever. So the thing is that we see that there are a lot of shared factors with gambling disorder, substance use disorder, and other behavioral addictions. And the thing is that is a lack of control on the behavior, and in this case, the behavior is pornography.
Because I can just imagine getting like the 9 criteria of the DSM-5 and just change gambling for you know
Oh, this
watching.
is
Yeah, and it's like, okay, pro,
right.
you have like the criteria. What's different, in terms of.
Yeah, this is what we are trying to discover, because
Okay.
the first proposal was like this, like take the criteria from gambling disorder, that the criteria from gambling was take from substance use disorder, and use it. But what happened that not it seems that not all the criteria are valid in problematic pornography use. For example, this is one researcher, and he really does really interesting work, like Joel Villiers, and he's publishing studies talking about this, that not all the criteria are valid in problematic pornography use and other behavioral addictions. For example, tolerance. He doesn't think that tolerance is a criteria in behavioral addictions, but it is a criteria in substance use disorder and other. So what he's saying is that we are assessing in the wrong way behavioral addictions, and we should change the way that we assess it, which is also complex. It's like the other topic we were talking before. It's complex to change everything because it's wrong. So it's been a debate around this.
Uh, but I suppose because I always have seen tolerance in gambling. Okay, that you need to increase, the frequency. Okay, you need, your fix quicker, you know,
Mm.
and then that you need more, and say, okay, I need to place a bigger stake, to get the same level of excitement somehow, so it's quite clear to me a bit like there's some tolerance there, so it's.
I'm checking what criteria he said, because maybe I'm wrong. It was tolerance, but
Maybe something,
yeah,
but
he's not.
yeah,
No.
it's interesting to see all the views. But I think sometimes it's important to have this conversation because okay, we agree on everything, and then we're stuck in the same place.
Exactly. Yeah, yeah. What's the a lot of researchers are saying is that we should, yeah, it was tolerance and salience.
Okay.
Uh, it, he has a manuscript. It's called "Salience and Tolerance Are Not Indicators of Problematic," well, in this case, problematic social media use. So what a lot of researchers are saying is that maybe we are putting in the same place all the behavioral addictions, and each one is different, and for each one different criteria should be taken into account, so not the same in all the, yeah, it's
Uh,
interesting.
I also wanted to ask you, okay, are we taking a little bit of a moralistic approach, to all these things? Because, for example, sometimes I think, okay, maybe, moderate gambling, or watching porn from time to time, or maybe, going for drinks, maybe a good.
Yeah, it's interesting, and another debate that we have. Um, yeah, there sometimes the recreational part of these behaviors is we forgot that these behaviors can be recreational for some people, and for example, Joel is trying to change this, also talking about, I'm not sure if you know the red box and green box, saying that for one individual, maybe some hours that he spent gaming, for example, are recreational, and it's not a problem with these hours that he spent gaming, but some hours are problematic and um, without control. So he's starting to ask people, okay, from the, I don't know, 10 hours that you have been gaming, uh, how many hours you spend with control and without problem, and how many hours you feel that were like problematic for you. So yeah, I think it's important, and in the science field we don't have moral perspective. For example, in pornography, this is really important because if you explore the research that was done a few years ago, it was moralistic. And even the definition that some researchers use as pornography had a moral component. So we should be neutral and explore these behaviors in a neutral way, which is, yeah.
Because sometimes I think, that I don't know, like it maybe like in the 80s, okay, all research about, marijuana is okay, it's bad, it's going to have like negative, and now it's been like a trend. Oh, it can be helpful for a lot of things, and I suppose, okay, maybe it's not one or the other, maybe somewhere in the middle. Maybe, you know screen time is not everything terrible, or playing video games. Okay, well, if you play a bit of time and play with friends, and don't spend too much money, it's okay, and have a good impact. But if you know maybe do it in excess to cope with you know unhappiness, then it's bad.
Yeah, I think that what happens usually is that in research we usually focus on clinical populations that have a problem with this, and the mistake is, for me, is to think that everyone will have a problem with these behaviors. That's why in all our studies we try to clarify that this is a problem that some people have, but not all the people, that we were talking before. And yeah, for example, in pornography, it was a bias, and all the studies were focusing only in negative consequences of pornography. And a few years ago, I started to read articles more focused in a neutral way, asking for consequences in general, or for example, on motivations. What kind of motivations give you to use pornography, for example? And these motivations can be a lot of motivations. Some motivations maybe are negative in a negative way, way because it's more compulsive motivations, and are saying that maybe now I have lost it, the
See,
connection.
I
Can you
think
hear
it
me?
has. Yeah, I can hear you, but it went a little bit choppy for like five seconds. Can you hear me now? Fine.
Yeah,
Can you hear me?
can
Okay,
you hear me
perfect.
right? Okay.
Yeah.
Yes.
Okay.
Okay. Yeah.
Yeah.
So
Sorry, I lost my train of thought. What were you
as
saying before?
that in pornography, studies are changing, and they are not focusing only in negative consequences right now. So they are, for example, asking for motivations to use pornography, which are more neutral topics. So I think research is evolving every time. Yeah.
It's interesting because you mentioned Joel. What's his surname?
Villiers.
Villiers. Yeah, because I've seen it many times, but it's a bit like, I'm not sure if I am brave enough to try to pronounce his surname. Uh, this is the research that this researcher like role games, like sort of 80s, you know.
The
Uh,
the green box, the red box. You mean?
and I think this researcher, I saw him, I think maybe a couple of years ago at the conference ICBA in Gibraltar, and he was talking about treating problematic gambling with role play games, like like Dungeons and Dragons and stuff like that.
Oh, I don't
I,
know.
I don't know, maybe it's not the same.
Was not in.
Like people that they were affected with problematic video game use, so they just get them in a place with a table and they were playing like Dungeons and Dragons with the dice and
I
and
didn't
all,
know.
and all of that. Have a check. I may be wrong. And I was thinking, that's really cool, because you get people together rather than online. Probably, you cannot be, you know you need to be a bit more pro-social. And then I thought, oh, I think also that was frowned upon, like in the back then in the 80s or something. They say, oh, like that's really bad. The kids, they're playing Dungeons and Dragons, that's a bit like a cult or something like that. So it's a bit like, oh, it's a bit like things are a little bit cyclical. Moving moving a little bit forward, I wanted to ask you about, okay, what's up, is there a relationship between gambling and porn? Do people that gamble tend to be more prone to watch porn in a sort of unhealthy way, or the other way around?
Well, we because I had these two interests, gambling and pornography. I convinced Susanna and her team to do research about this because no one, to the best of our knowledge, no one did it before. So we explore problematic pornography use in patients that came with a gambling disorder to be treated. So what we found was, so we had two groups, one group with only gambling and one group with gambling and problematic pornography use. So we found that this group with co-occurrence between gambling and pornography, they had a really complex clinical profile. They had more impulsivity, a personality profile more poor, and also they had more difficulties to maintain the treatment, and they had more relapses also. So it's a really complex profile, and then what we thought is that we should ask for this, even if one patient come with a clear disorder like gambling disorder, maybe we should ask for other problematic, like we were talking before, like other problems that they can have, because usually if they have more than one problem, then the profile is more complex.
I mean, I suppose that the stigma also increase, so if you're doing the screening, someone, that comes with a gambling problem that maybe is a bit apprehensive, and you ask, okay, do you also use porn in a unhealthy way? And then the person, oh, maybe it's too
Yeah.
much. Or if they know that they're going to screen them for something, they may put them off of. I mean, it's yeah, it's probably a bit like
Yeah, this is the complexity on the self-report assessments or clinical assessments that because you are assessing these people before they start treatment, and then we assess them later. But if you assess them before, then they don't talk about this in so clinicians don't talk about the disorder, and they are not used to talk about it. It's more difficult for them to talk about pornography or illegal acts or other things that they maybe did not expect. So yeah, this is a complexity of research.
yeah. I remember. I think like I don't know if it was this year or the year before. There was a case. I'm not sure. How truth is that, but I somebody told me that there was a gambling company that lost their license because there was like an adult entertainment star promoting the brand, or they were saying, look, we don't have is this something common? Is there some sort of overlap of marketing? Or
It starts to be more common, for example, with advertisements. So we can find advertisements about gambling in porn and like this. But I think it was, well, I don't know a lot about this case. I know that it was in the UK and was because one actress in porn. So yeah, in an advertisement of gambling, she talked about porn. It was a mix, but this is the proof that with internet the behaviors are mixing, and before internet it was so clear what was gambling, what was gaming, what was sex, and now with internet the line is it's not clear. And for example, we can find, well, gambling inside gaming with the lot boxes. We can find sexual features in gaming. We can find sex in gambling. So it's a mix, and it's more difficult for clinicians and for researchers every time to study these behaviors independently because they are mixing. So maybe we have to change the perspective and focus on a broader. Yeah, I don't
yeah,
know.
it's all mixed. It's quite interesting because I think like 2 or 3 weeks ago I was in Brussels for a conference and was a speaker, like gambling researcher. And at some point, he mentioned that his son was opening some, FIFA, sort of loot box, you know, or cards or something, and that he spent like 50 pounds, and he just got trashed. But he was like, had it in social media, and he got like, I don't know, like 2 million views or a million views, like a really big amount. And it was okay. There's so many mixed stuff there. Okay, you get people that, okay, you got the gambling because there's some features that they are really gamblified, even if it's a video game. Then you got like the likes and all of that, the social media, it's a bit like a cocktail of things. That is difficult to see the parts.
Yeah, it's now it's a big debate on how we should explore this. If we should talk about problematic use of the internet, and then in this umbrella term include all the behaviors, because every time it's more and more difficult to say, okay, this is gambling, this is gaming, this is porn. So we will
Uh,
see what
yeah,
happens.
I think probably the phone should come with a label, like the tobacco, like this phone can cause problems with your mental health, and you always,
Yeah.
because at the end, it's a bit like what were talking at the beginning, that the accessibility, when everything is accessible 24/7, everything can become a problem.
Sure.
I am mindful of the time, Gemma. Uh, is there anything that we have missed, that we haven't talked about? That you say, oh yeah, this is really interesting, I wanted to talk about.
No, I think yeah, that we should know that gambling, gaming, pornography are problems for some people. Then we need to work together, also with the industries, to regulate in the best way. In the yeah, in the best way together, and yeah, we'll keep going.
Okay. How people can find you? Say, oh yeah, I really enjoy, this podcast with Gemma. How do I find more about your work?
Oh, I guess that if you put my name on the internet, you will find something, or in PubMed, or I don't know. I can give you my email also if someone wants to.
As PubMed is like a research engine that
Yeah,
brings papers and stuff.
see, or
Oh,
Google Scholar is
Google
easier.
Scholar, yeah, that's easier. So Gemma, thank you very much for being with us, and thank you all for listening to this podcast.
Thank you for everything. Bye.
Bye.